Ilatat everyone. My name is Michelle DeGroot. I am from Tecumseh, Susaquatmo, and I work for the First Nations Health Authority as the Vice President of Fraser Salish Region. I'd like to acknowledge that I'm sitting in the ancestral and unceded territories of Tsleil-Waututh First Nation, and I'm honored and excited to have this opportunity to share highlights from the previous year of all the good work that took place with our communities and partners. First, I'd like to give my gratitude and acknowledge our First Nations leadership, elders, matriarchs, and youth, and to our healthcare workers who have championed health and wellness through another challenging year. Our communities came together with partners to support families during wildfires, floods, mudslides, and all of this during the ongoing pandemic response and toxic drug crisis. We acknowledge all of those we have lost during this time, and my heart and thoughts to all of those who are grieving. Our team has been hard at work since the beginning of the pandemic and in the past year, supporting our communities using a wraparound, trauma-informed approach grounded in culture. We have hosted multiple clinics within our land-based communities in partnership with communities, Fraser Health, and our 3 health service organizations, Seabirds, Tehalis, and Stala. We also provided on-site and mobile clinics for our urban and away-from-home brothers and sisters, as well as for those who are unsheltered and in encampment situations. In total, I am happy to report that we have successfully administered over 7,000 doses of vaccine. Another ongoing challenge we faced in the past year was the effects of the summer wildfires and November flooding events. This past summer, the province experienced a historically bad wildfire season, making the 3rd worst wildfire season on record. One of the most notable and devastating wildfires was the Lytton Creek wildfire, which torched the village of Lytton and forced evacuation of Lytton First Nation. In response, 3 emergency reception centers were opened in our region: Seabirds, Tehalis, and Shway Village. They welcomed evacuees from the interior region and provided shelter, food security, and cultural supports. As well, many of our communities collected donations of food, clothes, and other essential items to support the Lytton families. Last November, we also experienced exceptional levels of flooding up and down the Fraser Valley. The atmospheric rivers that caused this flooding also caused many mudslides, which cut up our communities for many days and cost some people their lives. Our regional team formed mobile teams that assisted communities, community members, evacuees, and our health partners with navigating health emergency management, finding accommodation, and provided direct health supports. As a team, we have improved our pathways in responding to emergency events and know these events will continue given climate change. I would also like to acknowledge the success story of Semiahmoo First Nation. After 16 years, a boil water advisory notice has been lifted. Much work has gone into that from the community and from various partners to make this a reality for them. In partnership with Fraser Health and the Regional First Nation Health Council members, the FNHA Board Chair, CEO, and Senior Executive Team, and myself participate on the Aboriginal Health Steering Committee. This committee is responsible for the Fraser Salish Partnership Accord, which was informed by our Regional Health and Wellness Plan. Some of the work in this area includes the regional team working with Fraser Health staff to develop and troubleshoot a regional complaints process that is client-centered, relationship-focused, and takes a restorative approach. Over the following year, we will continue to partner with Cheon First Nation and Fraser Health Authority to fully implement an in-community overdose prevention site and a mobile overdose prevention service that will reduce the impacts of the toxic drug crisis among First Nations and other people in the region. We also look forward to the important work that will be taking place to bring the vision of 2 healing centers into reality for the Fraser Salish region. Lastly, I would like to bring to light the engagement work that we have done over the past year. Our work is always guided by the First Nations whom we serve, and we welcome engagement with communities throughout the year and through caucus. At caucus, important steps were made on several key areas of work. I look forward to another great year working with our communities and our partners in moving forward our Regional Health and Wellness Plan and the dreams and visions that our communities have for their health and wellness. Also acknowledging again the resilience and strength of our communities. Coach Jen.